It is challenging. It's different than normal times. There are many components that are required to do proper testing. There's many things that needed for the collector. There are gowns that need to be on, certain types of goggles, many different type of masks that have to be done. There are different types of Q-tips, for lack of a better word, that we use for sampling. Some labs use one, some labs use another. There's different transport medium, viral mediums that you use. Each one of these is in short supply in many places, but it doesn't really matter. If you don't have one of them, you can't do the job. So there are many components that all have to come together to be able to do this safely and effectively. We've worked really hard to get those supplies, so currently we're in good shape, but a lot of people are missing essential equipment. We're a pretty busy clinic. We're seeing about 80 patients a day, but it's a different slice of patients than it used to be. We're not getting a lot of twisted ankles and minor bumps and bruises or even moderate injuries. The great majority are people with cough, fever, concern that they may or may not have a COVID-19 type of infection. So the numbers are not up. The complexity of the patients is way up. To take care of somebody who thinks they may or may not have a COVID-19 issue, which may include a very complex history, flu testing is possible, they may need a chest x-ray, other testing may be possible. It is 4 times longer and more paperwork than a twisted ankle, I assure you. It is a very complex question, and not one I can answer well for you. If you use it as a screening exam, the value of a screening exam totally depends on the incidence of disease in your population. If the disease is quite rare in the population and the screening test you use has even a small error rate, you find that in a very large percentage of your positives are false positives. So how that test is going to work will change over time. As the disease becomes more prevalent, it becomes more valuable, but then at a certain point it becomes useless, because if the disease is everywhere, if it walks like a duck, it quacks like a duck, and it's got feathers like a duck, it's a duck. So early on, when no one has the disease, these tests don't work very well. At the end, when everybody has the disease, they don't work very well, but there's a place when they are appropriate. That's why right now they're trying to limit it to people that have had known COVID exposure, because at least you get those odds up into that middle range where the test works valuable.
Okay.
To stay home and take care of themselves, take lots of liquids, acetaminophen, Tylenol, really stay well hydrated. I know that sounds cliche, but it really does help. Ibuprofen if it's appropriate for your medical conditions, things like that. Good nutrition, and above all, isolate. Isolate right now, especially from vulnerable people. Most of us know who they are. They're old people like me, and there are people with medical problems, and be conscious of that. Wash your hands frequently. This is a great virus for hand washing. I mean soap and water. You remember that stuff? This virus has a lipid membrane, perfect for soap to take care of. So soap and water, good scrubbing, and good hygiene, that's all you need to do. Testing people with no symptoms right now is a bad idea. It is a waste of resources, precious resources that need to be saved for those that require them.
Yeah.
At this point, I agree with the CDC and the local health department. I'm not saying anything different. There ought to be a fever involved, and it just so happens that fever is defined by the Celsius system. So in Fahrenheit, it's 100.4, which is 38 degrees is the temperature in centigrade. So that's a real fever. That's the number we use to define a fever. So it's a real fever and a real cough. Beyond that, there's some variability, but it's very common with this disease to feel quite fatigued. You might call it malaise, but you're just ragged out, no energy. And then there is also this shortness of breath that's a little bit more, not always wheezing, but feeling like you can't get a full breath. Also interesting is it tends to ramp up over 2 or 3 days. It's not like influenza A where that morning you think you're sick and that evening you think you're dying. I mean, it ramps up over 12 and 18 hours. I'm not saying that can't happen with COVID, but it tends to ramp up more like a standard cold does.
Okay.
No doubt about it. This social isolation is the only thing I know of that's going to help. It helps in a couple ways, and you'll hear this, I'm not the only one telling you this, but it's to slow the curve. There is a limit of essential life-saving equipment at hospitals. It is a very small percentage of people that get critically ill. But if everybody gets ill, that small percentage is way more than our hospitals can handle. And that happened in Italy, and it wasn't pretty. And this was in towns that are like our town, that are affluent, that have resources, and they were overrun in many places. So if you slow that down, where the disease builds up in the population much slower, then that small percentage of sick people can be taken care of, because the great majority of us will get a bad cold and get better in a week or so. There's also the hopeful phenomenon, and I believe there's some good evidence behind it, that the disease will naturally die out or lessen as we get into the summer months. Much like seasonal flu. It's everywhere in January and February, hard to find in March and April, and gone by May every year. Doing this 40 years, same pattern every year. We believe and we hope that this will also happen. So if we can delay it, maybe we can actually drop the entire number.